high magnesium levels, how doctors treat it, and what you need to know. Magnesium is an essential mineral, and your body is usually very good at keeping levels in balance. But is it possible to have too much? And if so, what do doctors actually do about it? Yes, it absolutely can happen. And whilst it's not common, when it does, it can become a serious medical situation. Let's break down what you need to know. First, an important point up front. The treatments we're covering in this video are carried out by healthcare professionals in a hospital setting. This is not something you can or should try to manage at home. So how does excess magnesium build up in the first place? Healthy kidneys do most of the work. They filter out any excess and excrete it through urine. In people with normal kidney function, dangerous levels are rare from food or typical over-the-counter doses. But when the kidneys aren't working as well as they should, particularly in more advanced chronic kidney disease or during an acute kidney injury, that ability to clear magnesium becomes compromised. Other contributing factors include taking large amounts of magnesium-containing antacids or laxatives, or receiving intravenous magnesium as part of a medical treatment. Elderly people and those with slower gut motility may also be at higher risk. What does too much magnesium actually feel like? At lower levels, symptoms can include nausea, flushing, and muscle weakness. As levels rise, things become more serious: low blood pressure, difficulty breathing, and problems with heart rhythm. At very high levels, this becomes a genuine emergency with the potential for dangerous cardiac arrhythmias, respiratory depression, and complete heart block. These situations need urgent medical attention. Now, how do doctors actually treat it? There are a few approaches typically used in combination depending on severity. The first step is always to stop any magnesium-containing products, supplements, antacids, or laxatives. Removing the source is essential. From there, doctors may administer intravenous calcium, which works quickly to counteract magnesium's effects on the heart and muscles. It doesn't remove the magnesium itself, but it protects the body whilst other treatments take effect. To actually clear the magnesium, patients with reasonable kidney function may be given intravenous fluids alongside a loop diuretic, encouraging the kidneys to excrete more magnesium through urine. In more severe cases, particularly where kidney function is significantly impaired or symptoms are life-threatening, haemodialysis is considered the most effective treatment, using a magnesium-free dialysate to draw excess magnesium out of the blood directly. If you have chronic kidney disease, this is particularly relevant. People with more advanced kidney disease are generally advised to avoid magnesium-containing laxatives and antacids unless their renal team has specifically said otherwise. It's worth having that conversation with your doctor or specialist if you're unsure about any products you're currently using. More broadly, if you're taking magnesium supplements and have any concerns about your kidney function, speak to your GP, pharmacist, or specialist. Never adjust a prescribed dose without guidance. When should you seek help urgently? If you or someone you know experiences sudden muscle weakness, difficulty breathing, an irregular heartbeat, or a significant drop in blood pressure, especially in the context of kidney disease or recent magnesium use in the UK, call 999 or go to A&E immediately. Don't wait to see if it improves. To recap, excess magnesium or hypermagnesemia is uncommon but can be serious, particularly in people with impaired kidney function. Healthy kidneys normally keep levels in check, but when they can't, hospital-based medical treatment is needed. That may include stopping magnesium sources, intravenous calcium, diuretics and fluids, or in severe cases, dialysis. Nothing in this video is a substitute for personal medical advice. If you have questions about your own health or medications, please speak to your GP, pharmacist, or a qualified healthcare professional. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please give this video a like and subscribe to the Bolt Pharmacy channel for more health information like this.